Hello there, my epilepsy warriors. This is my brain wreck. Hope you guys are doing good today and you haven't had any seizures at all, or you haven't had any epilepsy stuff related, or just seizures disorders in general. Hope you guys are doing great. And I know that we just celebrated Epilepsy Awareness Day, which is great. So, as you and I both know that we need a lot more funding out there, and we need to push it more out there. It's very hard to do and get funding for it, unfortunately. As I said in my other thing, it's not commercialized as much as it should be. I know it sounds weird when I say commercialized. And what I mean by that is actually see some commercials on the TV itself where it's actually on the news more often, a little bit more at least. I don't think it's pushed out there enough at all. So what we're going to talk about today is staring spells. What are they? Are they related to epilepsy? Yeah, they could be. Are they related to some things? There's absent seizures, yes, or what they call petite mal seizures. So basically, I know some of you guys out there may have staring spells. They're often associated with seizures. They're called absent seizures, or petite mal, I think is what they call them nowadays. So they're brief. They usually take less than 15 seconds. It involves a blank stare where it's kind of just the person's just looking there. They're not responding to you or anything. They're just out, and when they come back into it, they don't know what happened or why they weren't responding. Even though you guys may assume, somebody wants to assume, well, he's just playing with us or whatever. They're not playing with it. They don't know what happened. Something wasn't clicking up here the right way. Something got crossed in their brain. So I call this channel my brain wreck. So, I'll be like usually less than 15 seconds. It depends. It can involve a blank stare and temporary loss of awareness. So they don't know what's going on. So during a seizure, the person may stop what they're doing, stare blankly, and not respond to their surroundings. So they don't respond at all. They almost exhibit subtle body movements like lip smacking it like that or whatever, possibly, or fluttering eyelids like this, just for a few minutes or a few seconds. After the seizure, they typically return to their normal state of alertness without any memory of the event. So, just to remind you guys, this is for informational purposes only. I'm not a doctor, neurologist, hepatologist, a medical professional of any type. So, if you're concerned about certain things that may be similar to this or sound similar to what's going on in your life or somebody else's life, contact a doctor or medical profession. So, basically, absent seizures are a type of generalized seizure. It's generalized, that are characterized by a brief loss of awareness and blank stare, like I just demonstrated. And that can be scary to people, to loved ones, or even the person themselves, but they don't know what's going on. Obviously, they're just sitting there and look like they're trying to think of something, but they're not. they're completely out. They don't know what's going on around them. They are just, there's nothing they can't hear or anything is going on. So basically, these are often mistaken for daydreaming or inattentiveness. Sorry about that. So as I was mentioning, absent seizures can last between 3 to 15 seconds, maybe a little bit longer, depending on how the strength, I guess you could say, of it, or how much the other person is onto the staring space. So symptoms are a blank stare, brief processing activity, like, they could be like having on a computer and just stop all of a sudden and done what's going. And then, as I showed, with my body, the subtle body movements, example given, lip smacking, eyelid fluttering. All right, this going. Lack of awareness of surroundings. They don't know what's surrounding them or anything that's around them right now. So, when you're trying to talk to them, so they may not respond to you being spoken to because they're done what they're doing. They're just there, they're out of space. They don't come to for a little bit, and they won't remember what they did at all because there's other memories already taking up those other memories. So what happens is memories take up other memories. You have memory, long-term, short-term memory, working memory, so forth, or whatever. Those memories just get wiped out. There's new incoming memories that are coming into them or whatever. Something like that to effect. But I'm not positive on that. Like I said, I'm not a doctor. So this is for informational purposes only. Now, people do typically regain consciousness and normal alertness quickly. They do regain it. So what causes absent seizures, petit mal seizures or whatever, or generalized seizures, is a generalized seizure basically. It's abnormal electricity activity in the brain, so such as people that have epilepsy, like myself, I have nocturnal seizures, which those are usually more like our tonic-clonic seizures. My brain's erect, the things get crisscrossed or whatever, and they're not doing the pattern like they're supposed to, and not connecting. So there are different things that can be doing that they can treat it for. Treatment for absent seizures, of course, they involve medications from your doctor, neurologist, or whatever that they think they describe would be best for it. Lifestyle changes and sometimes surgery. Well, sometimes surgery can be where they take out, a piece of your brain, or put an RNS or VNS into you. Now, these are usually more common in children stuff. Doesn't mean it doesn't happen in adults or anything like that, because it does, but it's more common in children between the ages of 4 and 12. But all can also occur in adults, obviously. So the doctors, they'll perform a physical exam, of course, first, including a neurologic examination, and maybe order a EEG to check for abnormal brain activity. Doesn't mean they're going to find it all the time. They're not going to always find anything every time, so it's hard to say why they can't find it. Nothing, It's just what happens, unfortunately. Now, for those that are trying to educate themselves, for a friend or whatever that has epilepsy or some type of seizure disorder, or learning about it, kudos to you. I applaud you for doing that, because that's very good for you to learn to understand epilepsy and other seizure disorders. A lot of people talk about epilepsy, and like I said in my other videos, people think we're faking it. We're just doing it for attention. The graph thinking, oh, look, they're faking it, and they're over there. Yeah, that's why they end up in the hospital and they're put on a ventilator, right? For a few days. They don't come to. Think about that. Just like myself, I was put on a ventilator. You know why? Because I wasn't responding. I wasn't breathing. All 3 times. The last one I could have died. The first 2 I could have died. So all 3 seizures I could have died. So I want you people out there who are not educated about epilepsy, think about that. If your loved one, all of a sudden, later on in life, has a seizure or epilepsy and diagnosed with it, and that they can definitely die, educate yourself. Just like my nocturnal seizures, one of the most deadly kinds you can have. I can just die just like that, right in my sleep, with no warning or nothing. Thank goodness for my wife. She had to do CPR on me all 3 times. If it wasn't for her, doctors or the ambulance, EMTs coming to me, help saving me, I probably wouldn't be here talking to you about this. So, for all those out there, if this comes upon your feed, I want you to go educate yourself about epilepsy. There's a good website. It's called epilepsy.com. It has coping resources and educational things and stuff like that. So it's epilepsy.com. All right, I'll put it in the description. So, but I would like for you people that have friends or family or anybody that you're gonna make fun of, put yourself in their shoes. Whenever your shoe was on the other foot, as they say, what would happen to you? Would your friend be there for you or not? Is it a good friend? Are they trusting and they care for you? Or family? What would happen if you were diagnosed with epilepsy and you couldn't do anything, and you couldn't drive, your independence taken away, you had to find different ways to get to work or do something, you couldn't do the job that you're able to do anymore because that's certain restrictions you can't do. You can't climb ladders or anything like that because you have a seizure. What's going to happen? You're going to lose control. You're going to fall off that ladder, right? So thinking about that way. What about if they're walking across the street or something, even though they're doing okay and stuff, when they're walking across the street and all of a sudden they have a seizure right in the middle of the street going across the crosswalk. And some car or something doesn't see them. What's going to happen? They're going to go right over that person, right? So think about that. I want you people to put your shoes in other people's minds and thoughts. How do you think they feel when they lose their independence, and then they make feel, and you wonder why they get depressed, anxiety, and stress, and anxious, and why they feel like they're just a burden to society. Think about that. All right. So I highly suggest that for those that you don't know what's going on, get yourself educated. All right. I'm not trying to be mean or anything like that. I'm not saying you're a bad person or anything like that. I want those who don't understand epilepsy to have more understanding about it. And I'm trying to get it out there more as much as I possibly can. I'm only one person, but there's a lot more of us. Okay. There's a lot of them. Yes, there's a lot of epilepsy help stuff on the internet and stuff like that, but people still aren't educated enough about it. And unfortunately, the reason for that is there's just not enough funding for it. There's no grants for it. Yes, you can write a grant for it and stuff. Is it hard to write grants? Oh, you most definitely is it hard to write grants. You know, you got to word it just right. All that good stuff. But anyways, so if you have any friends with seizure disorders or any type of disorders or epilepsy or whatever, try to understand it. See what causes it. Why? Talk to them. Like I said in my other videos, talk to somebody that had epilepsy. Hang out with them one day. Just anybody. Go on the day in life with them. Go on daughter swim if they're willing to let you go there, or see what they do have to get. See what they have to do to get around for transportation. Let's say that you don't. Let's say you just go there, but you pretend like you don't have any transportation, and you go with them and see how they get around. So all I'm asking for you out there, folks, is to educate yourself about epilepsy and other seizure disorders. Because we're human beings like everybody else. We as humans need to be kind to one another. That's all you have to do. It doesn't hurt to say kind words or be humble. Use your humbleness, plain and simple. So anyways, we're going to continue here. So first aid. So during a seizure surgery, remind you of surgery. People with epilepsy do get surgery sometimes. It is important to stay with the person, guide them away from danger, and reassure them. So, yes. Guide them away from danger and reassure them. And I'm looking at stuff up here. So, as I mentioned, it was an absent seizure. So, I'm looking over here on epilepsy.com, one of my favorite websites to go to and get information from. Remind you, this is for information purposes only. All right. And this talks about absent seizures, which falls underneath staring and so. So, basically, it's a short period of blinking out or staring into space, like other kinds of seizures. They are caused by a brief abnormal electrical activity in a person's brain. So, electrical activity in your brain is going crazy. It's getting the circuits crossed. So, it's basically considered a generalized and absent seizure is our petit mal. It's a generalized onset seizure, which means it begins on both sides of the brain at the same time. So, both sides. But unfortunately, both sides aren't communicating, so circuits are going this way, going this way, are not communicating the right way. Okay, excuse me, an older term is petit mal, I apologize. However, the term is not preferred as it is not specific for absent. Petit mal is not preferred, as specific for absent seizures can also be used to describe focal seizures. So, they're focalized rather, so they're focal. Look like they're focal. Foci is the plural, or focal. Look, they're focalizing on something. They're just staring out. Look like they're staring on something, and then they're being focal. So absent seizures, basically, they are so brief and are often missed. So you may not know something, and you may just think a person's just staring off into space or something. They're tired and they're just going like this. They're actually looks like they're focusing on something. That's why sometimes they're called focal seizures, not absent seizures, but there's different terms and stuff. So, what do absent seizures look like? There are two types of absent seizures that may look a bit different. All right. So both the type of seizures are short, and people often don't notice them at first. And they're not going to notice them. They may come and go so quickly that no one knows anything wrong, or observers may mistake the symptoms for simple daydreaming or not paying attention, as I just mentioned. So typical absent seizures. Typical absent seizures are most common. The person suddenly stops all activity without any warning. It may look like he or she is staring off into space or just has a blank look. And then the eyes, they may turn upward and flutter like that, so forth. They usually last 10 to 20 seconds, maybe less, depending. A person may be momentarily confused for only a few seconds, but then it's back to normal, and just like, oh, okay. And they go back to anything what they thought they were doing. Now, atypical absence seizures. These absent seizures are called atypical because they may be longer, have a slower onset and offset, involving different symptoms. The seizure still starts with staring into space, usually with a blank look. All right, basically like that. You're probably wondering, like, why aren't they looking on the wall over there for? Well, that person may be having a seizure. It's hard to tell. It's hard to recognize. There's usually a change in muscle tone and movement. You may see blinking over and over that may look like fluttering of the eyelids, as I just demonstrated a few times, smacking the lips or chewing movements, rubbing fingers together or making other hand motions, they can be just going like this. You really don't know. Atypical seizure lasts longer, so it's going to be up to 20 seconds or more. All right. So as mentioned, absence seizures are so brief they are often missed, and this is why sometimes people think they're like people looking for attention and they're just goofing around and being whoever or whatever and just think they may be a jokester or whatever, but this is something serious you have to consider with. So, like I said, for those that are out there, that are not educated about epilepsy, please share this with other people. All right, very important that epilepsy is shared just as much as breast cancer and heart attacks, type 2 diabetes, any kind of other disorders. Everything. Epilepsy affects more people than I think it's MS. I can't remember else. A couple other things than combined all together. MS, Lou Gehrig's, and I want to say Parkinson's disease, all combined together. It affects more people than those all combined together. So that's to put in perspective a little bit. And I'm not trying to take away from all that because those are serious things also. So who's at risk for these type of seizures? These petite mals, as these call them, or absent seizures. So basically, they are most common in children from age 4 to 14. However, older teens and adults may also have absent seizures. So they can have absent seizures. Some people have absent seizures for many months or years before it's recognized as a problem. Causes of this delay may include, it's very common for people to mistake absent seizures for daydreaming or not paying attention. So some people might think, maybe they have ADHD or something like that or whatever. But I mean, it's possible they could go along with absent seizures, maybe. No one knows. Only doctors and medical professionals will be aware of that. Like I said, once more, I'm just putting this in here again. I'm not a medical professional. I'm just passing out information for you guys to understand, to help to learn. All right, the best I can, anyways. I'm trying to dumb it down for me and all of us. So absent seizures are most likely to affect children, and paying attention is a common problem for children. Since daydreaming can happen often in school for many different reasons, it may be hard to know if the staring is a seizure or not. So, which, like I said, ADHD maybe, and then all of a sudden they switch and go to something else. They're staring, look up on the wall, especially children. Children are totally different. So children have to be looked at differently than us as adults. So when we're children, we're looked at differently. When we get adults, totally different. So often the first clue that children may be having absent seizures is when he or she starts having trouble in school. So like myself, maybe, I did really good at school. I did really good at math for the longest time until I got up to the higher grades. I did okay. When I got to high school, algebra and whatever. I did just teach algebra in 6th grade, but once I started throwing those letters in there and everything, I was Like, whoa, okay, what are these letters here for? I understand it's used for certain things, whatever. I was fast. They had these when I was younger. They had these little, it's a cardboard thing, and in the center you put your piece of math paper in there, and then I think you get like 30 seconds, maybe a minute. And there's like 60 questions. You had to answer there. It was either multiplications, division, adding or subtracting, and I was super fast at it. I usually finished within 20 seconds because I knew all the answers. It just popped in my head somehow, and I finished them fast. And the teacher's like, "Well, that's amazing. How do you finish that so fast?" But that was then when my brain actually worked the right way, I guess. So, but as I got older, my brain somehow, I don't know, it just disappeared, and geometry and stuff like that. I have no idea what happened. It just tried my best, but so. By the way, my background's on criminal justice, so if you have a criminal justice background question, let me know. I'll answer it the best I can. I know this video is a little bit long, but I just want to get this out to people for epilepsy and seizures and all that stuff. This is why I started this channel, for my brain wreck, so people get an idea. I know some of you that have epilepsy out there, and like, yeah, that pertains to me. That works with me. I can see why. So what is it like to have an absent seizure? Well, I myself, I haven't never had absent seizures. I don't know what it's like. I've had nocturnal seizures, 3 of them, and I have no idea what they're like because I wasn't awake. I was out, waking up in the back of the ambulance or waking up on a stretcher going to the ambulance, waking up in the hospital. Now you know where the heck I am. So what's it like to have a absent seizure? Excuse me. When people have absent seizures, they are not aware of what's happening around them. For example, they will not notice if someone tries to speak to them during a seizure. They're not going to notice. They're out. They're out to La La Land. All right? They're gone. They're in their own space somewhere else. So if a person is speaking when their seizure begins, they will stop talking, often in the middle of a sentence. It may seem like a pause to an observer. So you can be talking to somebody, you're going to have a normal conversation, and all of a sudden they just stop. Claire, they're answering your background, and you're trying to wait, and they're not going to hear you at all. So take that into consideration. That could be possible. Even though the person, they may be joking. Some of them, I'm not saying that people that have epilepsy joke. I'm just saying if there's a jokester in your family, but take it seriously. Whether or not you think they're joking or looking for attention, take it seriously. If you're not sure anything else going on with them, call 911. When in doubt, call 911. So, just like the saying, when in doubt, call them out. We learned that from dispatch class, or either from or whatever. But if the absent seizure is very short, the person may not be aware they even had a seizure. If it's a bit longer, they may be aware that they have had missed some time. All right? So that could happen after they have some time. They noticed them, like, oh wow, where did time go? That was weird. So basically, what happens after an absent seizure? What goes on in that person's little mind, and what they're gonna do, and how it's going? So when an absent seizure ends, the person usually continues doing whatever they were doing before the seizure. They're almost always wide awake and able to think clearly. Generally, no first aid is needed for this type of seizure. So generally, but if you don't know what's going on or anything and why they're acting strange or weird like that, still call 911. It's better to cover your butt. What I'm saying is, because you never know. Something else can turn. It could turn to something else. Let's say you go from an absent seizure to a grand mal seizure. Let's say all of a sudden, or a tonic-clonic seizure or something just totally, from one seizure to something else that totally distorts the body. So call 911 if you're not sure. All right. The best bet is just to call them. So when absent seizures happen close together, or a person has many in a day, so you pick it up to 20 in a day, 100 in a day, it's hard to say. There's lots of people out there that have a lot. I know some people that have had seizures and stuff, and I've had quite a bit. Now think about that. Imagine being that person and having over 30 seizures a day. Could you imagine that? So that's why I think, as I said again, I know I was getting a little bit loud and stuff because it just irks me that people aren't educated enough with epilepsy. And it's not commercialized, as I say, not known much about it as some people should be known about. One place I know that is not known. I mean, I know in the United Kingdom there's quite a few people that have epilepsy over there. There's one place, I believe, if I'm not mistaken. So people in the UK, over there in the UK, you know what I'm talking about. In Canada and the United States. I'm not saying everybody else, but UK, there's quite a few people over there from us now. So when absence seizures happen close together, our person has many in a day, the person may look or act confused, lose track of what has been going on. So for children in school, they may not be aware of what has happened in the classroom, miss instructions from the teacher, or have incomplete work. So that's why it's always important to let the school staff know any type of medical things that need to be addressed or whatever, or anything accommodations that the school can do for you, for your child. So always bring that up front, no matter what. That way you have some help. And if they're not willing to help, so try to find some outside resources or something. I understand school staff, there's shortages and stuff like that go on, and sometimes schools just, I hate to say it, don't care worth a darn. But hopefully there are some that do. So it says, now how if somebody has absent seizures, how often will they happen? Well, the number of absent seizures a person may have varies a lot. Seizure medicines can control absent seizures in many children, so they have rare seizures or none at all. Other people may have hundreds of brief absent seizures a day, as I mentioned, hundreds, a lot. So, how are they diagnosed? So, this is very important. So hopefully this is helping you guys some a little bit. Me putting this information out to you. I know it's a long video, and I do apologize. But sometimes it's easier when somebody talks about it and gets it out there. Doesn't look up all the information himself. So, like I said, I find all my information on epilepsy.com. You can find lots of information. Great resource to have stuff on there. So how are they diagnosed? Well, a good description of what happened is important. So write down what happened. Usually this description comes from people who have seen the seizures, a parent, a teacher, or other family member. So write down what happened. What they do? Were they eating at the time when they're going on sleeps? Were they laying down, sleeping, or were they playing video games? Were they on to use the restroom, taking a shower, a bath, etc. Especially for young children. The event sounds like seizures or other symptoms have happened. The doctor will order an EEG. So, electroencephalogram. All right, that was a long word. So EEG was called EEG, obviously. EEG checks electrical activity in the brain for patterns usually seen in absent seizures. Nearly all persons with absent seizures who are not on anti-seizure medicine will have an abnormal EEG suggesting this diagnosis. So if they're not on it, it will suggest it, obviously. So during the EEG, you be asked to breathe fast, close your eyes while lights are flashed fast, which I've had those where the lights are flashed fast in the eyes. They're bright lights. They're basically strobe lights to see how your eyes are reacting and stuff, and see if it'll cause a seizure also, which me luckily has not, so far as we know anyways. That's what I was telling you. And also I mentioned I had a 48-hour ambulatory EEG at home, but all they found was a bunch of anomalies, which it could have been my environment I'm in due to electronic internets or things around me, who knows. These things may make it easier to see absent seizure patterns on an EEG. So, how are they treated? Well, certain anti-medicines can help prevent absent seizures. Usually, these are recommended for most children. The medicines that are most commonly used for absent seizures include, I'm going to try to pronounce these my best, can't guarantee it, ethosimexide, or Zeratone, okay, there we go, that's our names, Lamictal, Depakote, Depakote, alright. So, out of about 7 out of children with absent seizures, these seizures may go away by the age 18. So they may outgrow them and stuff. It's not necessarily that seizures won't come back, because seizures can come back, because we don't know what's going to happen, if they're actually going to come back. Doctors aren't going to know. They may understand to a certain degree what they can do and fix it and make it stop for a long, long time. Maybe it won't come back at all. This happens, medicine may not be needed as an adult. Children who start having absent seizures before age 9 are much more likely to outgrow them and children whose absent seizures start after age 10. So they're going to outgrow them more than likely. So let's hope and pray for that they do, right? So for other children, seizure medication may be needed long term. Sometimes other types of seizures can emerge over time, as I mentioned, including generalized tonic-clonic or myoclonic seizures. These other seizures types are more likely to occur if absent seizures began after 10 years of an age. Neurologists can help you learn about the risks, treatments, and outlook for the future. Also, on a side note here, check into your family history. You know, if there's any history of seizures or any type of things that you may know of that have happened back then. Anybody in your family history, actually blood related down the line somewhere. See if you can find some of your uncles, aunts. Not uncles. Oh yeah, because your uncles, aunts, brothers, sisters, way down. See how far you can go down, get the medical records or whatever, or understand from other people, what you can do. So, what should you do if I think my child may have absent seizures? Well, pretty simple. Go to your doctor. So if you think your child may have an absent seizures, talk to your child's doctor about your concerns right away. Absent seizures may be confused with other types of seizures because they can look similar. That's why they want to get that out of the way. That's another reason why it's so important that your child see a doctor for a correct diagnosis. If the diagnosis is not clear, your child continues to have problems, see a neurologist. All right. So kids who have absent seizures aren't usually in danger during a seizure. However, absent seizures may cause your child to have trouble learning at school, have social problems, and misbehave more often. And that I find to be true for a lot of kids and stuff, from stuff I read from another board that I'm on, that their children's acts differently or behaves differently. But it could be from, if they've been assigned some medicine or whatever, also can cause them to act differently. There's all time, because sometimes certain meds will interact with other things and make people misbehave. So how do you tell the difference between daydreaming and absent seizures? Well, it's hard to tell. It's hard to diagnose. That's why you have doctors and neurologists and also epileptologists. So if you're wondering whether your child is daydreaming or having absent seizures, here are a few key differences to look for. Okay. For daydreaming, it's more likely to happen when your child is bored, for example, during a long class at school. It usually comes on slowly, can be interrupted by calling your child's name loudly or touching them, tends to continue until something stops, for example, the teacher, a friend, or parent getting the child's attention. All right. Okay, now absent seizures can happen anytime, including during physical activity, usually come on very suddenly without warning. Cannot be interrupted, even with more vigorous stimulation like tickling or poking them. Not going to do nothing to them. They're in a totally different state of mind. Their brain's not working. It's set on one thing and they just aren't listening to you. They're inaudible. End on their own, typically within 10 to 20 seconds. Okay? So they will end eventually within 10 to 20 seconds, but they'll get right back into the thing because they aren't going to remember what was happening between those 10 and 20 seconds. Now this says, how can I tell the difference between absent seizures and focal impaired awareness seizures? So, a little bit different here, right? Like I said, there are over 40 plus different types of seizures out there, all kinds of stuff. There's things called the Dravet syndrome, alcoholic seizures, and so forth. Diabetic seizures. It's like with myself, I'm type 2 diabetic, but I haven't had seizures yet. Well, I've had nocturnal seizures, but not diabetic seizures. Seizures that involve stirring and a change in awareness are sometimes mislabeled as absent seizures. People often confuse absent seizures with focal impaired awareness seizures. There are some key signs that happen before and after the seizure that help us to decide. So which type of seizure a person is having, let's try that over again. I'm going to read this out. I'm just reading some stuff over here. There are some key signs that happen before and after a seizure that help us decide which type of seizure a person is having. So it's the length of the seizure and the frequency of seizures are also helpful observations to keep track of. So how long they are, how short they are. All of this information, along with the result of EEG testing from your doctor, neurologist, whatever, can help to accurately diagnose which type of seizures person is having. More than likely, a neurologist can do the diagnosis with the epilepsy or whatever seizures you're having. Usually won't be your doctor. Okay, so now the following features are most suggestive of focal impaired awareness seizures. Warning, an aura prior to the seizure. There's an aura, a smell of something, everything is going on. Like, smell burnt wires, you smell something, a deja vu, I guess you say. Like, I just feel like this happened before. What happened here? I feel like I'm going through the same thing again. No, it's an aura. You guys know what an aura is. Something that's, you have a feeling of something's going to happen prior to the seizure. So, confusion and sleepiness after the seizure. Postictal state, excuse me, after. And duration longer than 30 to 45 seconds. So, this is focal impaired, okay? Seizures occur less often than daily. So, not occur as much, but occur less often. So, basically, that's what it is, all right, guys? For a stirring spell and stuff, absent seizures, and as I mentioned, I said about tonic clank and stuff. And we'll get more into the different seizures and stuff like that, but I just thought for those, this would be interesting for those people who are trying to learn and what they are. And as I said, I know it's a very long video, which hopefully gets out to people or whatever. I want people to understand that it's very important to educate yourself about epilepsy. For those that have just been recently diagnosed with epilepsy, that you keep up on your stuff and don't be afraid to ask the doctor for something, or your neurologist. Write down everything that happens to you. Write down the date, the time, your concerns, everything. Make a copy for yourself. Give a copy to your doctor or the tech or whatever. That way, you're leaving yourself a medical trail. Okay? That way, it may show a pattern or something that's going on with you, and the doctor can interpret that. Like today I felt sluggish and stuff. The next day you feel even real tired. Today I feel anxiety. Today I feel stress. So write the date, time, and year also, and the month, of when this happened. And make a copy of each little thing. If you got a printer at home, do 2 copies of it. One for your doctor, one for yourself. That way you can keep your own little medical folder at home, like a journal or whatever, and you're keeping a medical trail for yourself and stuff. And this will also help you later on or whatever if, say you can't work anymore, whatever. You got yourself a trail there of what's going on, whatever, and hopefully the doctor will write down or put in his notes or whatever, and our technician or whoever his assistant will. And if you need to apply for disability because you can't work anymore. So that's one idea. I think that's a very good idea personally. Write down what's going on with you for the day, what happened, if you can remember whatever, how you're feeling beforehand or whatever. And then after your seizure, which you won't know if you had a seizure or not, but write down how you're feeling afterwards or whatever. It's like you're told you're in a hospital today. You're like, somehow I ended up in the hospital. I don't know why I'm here, but here I am. They said I had some swelling on the brain, or I had a bleed on the brain. I bit my tongue. So if you can, try to put that into your cell phone or whatever, and then copy it to your journal or whatever, a medical book. Like just a regular notebook pad or whatever, and make a copy for yourself. And once again, make a copy for your doctor so they have a medical trail and yourself has a medical trail. So hopefully this helps, and hope you understand what I'm trying to get across. And to all my purple epilepsy warriors out there, stay strong, stay seizure free, and keep on fighting the good fight. All right, don't give up. You just have to keep your faith. All right. As myself, like I said, I'm always a Christian faith priest. I'm also an ordained minister. So do what you can. So if some of the video for you, if I see it seems long, I do apologize. I think people need to be more educated on epilepsy. It's just not out there enough. And for those who have epilepsy, who have had it for a long time, you know what I'm talking about. I just recently got diagnosed with it not that long ago. My seizures have been under control for 2 years now. Praise God. Thank you. And my wife and all the others that helped me where I'm at today. So 3 times could almost die. So obviously I'm here for a reason. So maybe this is a reason. So if this pops on your feed or whatever, when you're seeing this, stick around and watch it. Maybe you'll learn something. If it's boring you, I do apologize. I'm not trying to bore you. I'm just trying to get out information out there. And this is just information purposes only. All right. If you have any concerns or whatnots, contact your doctor, your nurse, your medical team profession, so our neurologist. All right. This is just for information. I'm not here for providing any medical advice or anything like that. Okay? So, like I said, contact your medical professions for anything like that. But if you want to ask me something for about criminal justice, that's my background, be more than happy to help you in that. So, thanks for watching My Brain Wreck. All right? So, My Brain Wreck. So, all of us that have epilepsy, our brain took a wreck, right? And they just still got crisscrossed. And some of us have stuff in here. Some of us had stuff taken out. Some of us had implanted or implanted down here, right here, whatever, to help us. So, but anyways, thanks for watching. This is My Brain Wreck. If you like my channel, like, subscribe, press that bell button for notifications, and share my content. Give me a thumbs up and a comment and whatever. That helps the algorithm, helps me out. And I enjoy doing this. So thanks for watching. Have a great day. And be seizure free, my epilepsy warriors. All right. Thanks for watching. And wear that purple strong.